There are other kinds of medicines that they generally use for cardiovascular issues, for high blood pressure, for example, and related cardio issues, are diuretics, because all of that stress puts a whole lot of stress on the kidneys. They get kind of blocked up, and so they use generally some form of diuretic, HCZT, hydrochlorothiazide, being the most popular. But there's an actually natural herbal approach, which is a kidney flush. And there are herbs like juniper berries, buccal root, and my favorite, uva ursi, which is anti-infective. And these kinds of herbs have a natural diuretic effect on the kidneys, again, without the side effects.
Hi there, welcome to another Real Talk with Dr. Jim Sharps. Great to have you back with us. I'm really along for another kind of exploration of a topic from the perspective of original medicine. For those of you that know the channel, I can kind of pause and skip forward 20 seconds. For those that are new, really we're aiming to demystify a lot of original medicine and make it accessible and really be a springboard for further learning to make more empowered health choices. And that's really why we're here. That's the kind of content that we try to record to be of value, practical value to people that watch and view our content. So hope you find that valuable. Do check out our other content if you do appreciate it. Don't forget to hit like and subscribe, as well as hit the notification bell so you're made aware when we publish a new video. So in terms of topic for today, we're going to look at a kind of a very common ailment, so to speak, or common health issue that comes up, and around the world I'm sure many people will be familiar with it, and that's cardiovascular disease. So Dr. Jim, we'll just go through kind of, as we do, try and give a frame and give some practical takeaways that people can implement in their daily lives to be more informed, but also lead to kind of better health outcomes. So in terms of a good frame for us, Dr. Jim, in terms of the first question, what are some of the key kind of dietary choices and foods that are known to reduce the risk of cardiovascular disease?
Yes, for cardiovascular disease, there is a diet that is very helpful to help avoid a whole host of cardiovascular issues. And that's the plant-based diet, the whole food plant-based diet. Some people consider, processed foods part of that, but when I talk about whole foods and plant foods, they need to be eaten together, whole food, plant-based. And the best kinds of foods are like green leafy vegetables, things like chard and spinach and watercress, endive, romaine, escarole, arugula, any kind of green leafy vegetables, beet tops. They are excellent for heart health. There are certain foods that have certain nutrients in it that are particularly good. Asparagus is a very powerful heart healthy food, and people have heard of garlic. It's anti-infective, it's antimicrobial, and it helps to thin the blood, and even things like berries with a whole host of proanthocyanidins and antioxidants. So fruits, vegetables, and then things like garlic, onions. These are the kind of foods that they belong to the plant type of food. So plant-based whole foods are the absolutely best for the healthy heart. And one food that people tend to neglect, and it's readily available, and the most important food, and without which none of these others work, even supplements, is water. But people don't consider water a food, but water is very, very helpful for keeping the blood quantity right, the blood volume right, for the cleansing, for the circulation. So water, and one of the things that you might notice about all of those foods I mentioned, fruits and vegetables, whole plant-based foods, they're high water content foods themselves. And that's why you can kind of get away with not drinking the water, but water should be a part of that dietary regime for a good, heart healthy approach to menu planning.
That's great, Dr. Jim, and very clear. So you mentioned water as a key part of that equation. What role does physical activity play in terms of cardiovascular wellness, and what are some kind of accessible options for people of all ages?
Yes, a really good question. Exercise is extremely important for heart health. One of the very important factors for health is trying to eliminate the toxins in the system. And you have these organs of elimination, the bowel, the lungs, kidneys being the ones that are most obvious. But the lymphatic system is very important. It's a transportation system for a lot of the toxins. And the only way the lymphatic system is engaged is through movement. So exercise is kind of a rhythmic, coordinated movement, if you will. So an active exercise program is very, very helpful to keeping the blood pure, and the type of exercise you do is important. But any kind of rhythmic exercise, some exercises will actually produce sweat. And sweat is also another means of eliminating toxins from the system. A lot of that excess salt, a lot of those toxins, when you have that circulation going, comes out through the skin. So exercise along with diet is a very powerful component for preventing and reversing cardiovascular issues.
And in terms of we've spoken about this in recent videos from a herbal perspective, what impact can herbs have on kind of cardiovascular health, and how can they be used safely in this context?
Yeah, really good question. Herbs can be very helpful. There are basically the kind of medicines that are used. They're either ACE inhibitors, beta blockers, calcium channel blockers, but there are foods that actually have these components in there without the side effects that have the other cofactors in with the food or in with the herb that basically do the same thing as the medications do, but without the side effects. And my favorite is hawthorn berries. Hawthorn berries have at least 3 ACE inhibitors, 3 beta blockers, and 3 calcium channel blockers. There are other kinds of medicines that they generally use for cardiovascular issues, for high blood pressure, for example, and related cardio issues, are diuretics, because all of that stress puts a whole lot of stress on the kidneys. They get kind of blocked up, and so they use generally some form of diuretic, HCZT, hydrochlorothiazide being the most popular. But there's an actually natural herbal approach, which is a kidney flush. And there are herbs like juniper berries, buccal root, and my favorite, uva ursi, which is anti-infective. And these kinds of herbs have a natural diuretic effect on the kidneys, again, without the side effects. So there are a number of herbs, those are my favorite. And even juicing can actually provide some of those same kinds of effects. And watermelon seed, tea. So high water content foods like the melons and natural diuretics and various selective herbs like the ones we mentioned are very, very powerful adjuncts to a program in helping with cardiovascular issue prevention and recovery.
That's clear. And then kind of transitioning into stress. What does stress management and relaxation, how can that impact heart health? Are there some kind of recommended effective methods that you would have?
Yeah, stress puts a major impact on the cardio system. It causes the heart to beat too hard. You're producing too much cortisol, which is a vasoconstrictor. It constricts the blood vessels. And so all these things, long-term stress has a profound effect. And it can be a mental, emotional, physical, any kind of stress that is constant like that puts a huge impact, a huge burden on the system. And there are a number of things you can do. Of course, dietary. The better the diet is, you don't want that's one thing that you can do. to reduce the stress. But recreation, sufficient rest, and there are natural therapies like contrast showers. Contrast showers are a blood massage. With the hot and cold treatment, you're causing vasoconstriction and contraction to open up and close the blood vessels. You're kind of massaging the blood through. Warm baths are really good. It opens up those blood vessels, and it even dilates the skin so the toxins come out in the water, and you get that circulation. And you can add things to it like Epsom salt, lavender oil, baking soda, oatmeal to actually support the skin at the same time. So there are a whole host of these therapies that you can use, natural therapies, in addition to herbs or supplements like 5-HTP, SAM-E, holy basil, lithium orotate. These are natural substances that you can use to help with mental, emotional, and or physical stress. So you get all three of those, and based on the kinds of stress, there are a whole host of therapies that will help you to kind of manage the stress in your life and consequently promote improved cardiovascular health.
Great. And one final question. Can you provide guidance on kind of a holistic plan that combines natural health and promoting long-term cardiovascular wellness?
Yeah, well, that's a really good question. And the bottom line is, for cardiovascular health, just like for health in anything, I would encourage the integrated and comprehensive application of the laws of health. So you want to get fresh air as much as possible. You want to get good, clean water and a sufficient amount of water. As we mentioned already, exercise. Sunlight is very important. It helps to reduce cholesterol and convert cholesterol to vitamin D. So, the air, water, sunlight, nutrition, exercise, rest, mental, physical, and spiritual kinds of activities to reduce the stress in your life. And one of those things that we tend to overlook, one of those other factors, is something called temperance or moderation. And that law of health basically says that you want to avoid things, dietary or lifestyle, that are harmful, and doing even those things that are good in moderation, based on your requirements and based on your capacities. And so those kinds of things, and then rest, getting enough rest is probably very, very key. People don't pay enough attention to that. They pay attention to the air and the water, but rest is important. So getting enough sleep, and if you're under a lot of stress, if you're having trouble sleeping, there's actually really good herbal teas like chamomile, like passion flower. Ashwagandha is a really good herb to kind of help to relax you, and it's an adaptogen, which means that if things are too high, it'll lower it. If it's too low, it raises it. A valerian root. So there's a whole host of what are called nervine herbals that you can also include in your health regime. And all of these factors that we discussed can be used in a very thoughtful, commonsensical way, based on your requirements, based on your lifestyle, to promote long-term health and vitality. And if you do these things, even in a moderate way, at least 80 to 95% of the cardiovascular issues would go away in a matter of weeks.
Dr. Jim, I think that's a great place to leave the video for today. For those watching, I hope that's been valuable. We'll continue the series. If you have any questions or comments, please do leave them in the comment section. We do review that regularly. And if you do have kind of content suggestions or topics that you'd like Dr. Jim to cover, please do also leave a comment and we can put that into our kind of content schedule. That's all for today. Thanks for being with us. Until the next time, bye for now.
Bye for now. God bless.